Welcome to our session on understanding medical bills. My name is Aaliyah McKinley, and I'm the Director of Community Outreach and Education at the Asclepius Initiative. First, I want to welcome you to the Asclepius Initiative. You might be wondering about our name, as it certainly is unique. Asclepius comes from Greek mythology, and it represents medicine and healing. And our goal of the Asclepius Initiative is to raise awareness and promote change to make continuous, high quality, affordable healthcare coverage a reality for all. It's easy to assume our medical bills are correct, and we just pay them without reviewing their contents. The complexity of medical billing and insurance is enough to make you just want to be done with your bills and move on to something less stressful. But do you ever wonder if you're paying for charges that you don't owe? It has been reported that as many as 80% of medical bills are incorrect. We all tend to get overwhelmed in the doctor's office. The Asclepius Initiative wants to empower you to only pay for what you owe so that you have money to spend on other things or even other medical services that you would otherwise be unable to afford. Learning to navigate your coverage makes you a more educated consumer of health services and better equipped to advocate for yourself. We are going to learn how to figure out what you're being asked to pay for, how to make sure you're only paying for services you receive, how to tell what your insurance covers and what costs are your responsibility, and whether the insurance company is following the rules it has set out for your plan. We'll begin by reviewing some insurance terminology. Household. The marketplace generally considers your household to be you, your spouse if you are married, and your tax dependents. Premium. The amount paid per month for an insurance policy. Deductible. The annual amount that your insurance company requires you to pay for medical services before they'll start to pay for the care that you receive. Except for certain preventive services and those for which there's a copayment, commercial carriers typically will not pay for any healthcare services until you've met your deductible. Once the deductible has been met, you most likely will still be required to pay something for the healthcare services which you receive until you have met your out-of-pocket maximum. Copay. A fixed amount you may be required to pay for things like office visits, medications, emergency room visits, outpatient care, labs, surgeries, and the like prior to or after meeting your deductible. Coinsurance, a percentage amount of the allowed cost of your medical care that you're required to pay. For example, with an 80/20 plan, if the allowable for medical services was $100 and you had met your deductible, of the $100 charge, you would pay 20% or $20, and your insurance would pay the remaining 80% or $80. Out-of-pocket maximum, which applies to individual and family coverage. This is the most that you can be required to pay for covered medical costs within a given plan benefit year, not including your monthly premium. This typically consists of the amount that you pay for deductibles, copays, and coinsurance. Networks refer to whether or not your insurance carrier has a contract with a particular provider for use under your plan. Networks exist to control cost and supposedly quality. When we say in network, we're talking about using a healthcare provider that has a contract with the insurer to provide healthcare services to those covered by the plan at pre negotiated rates. Out of network, on the other hand, refers to a healthcare provider who doesn't have a negotiated contract to deliver services under your health insurance plan. If you use an out of network provider, healthcare services could and almost always will cost more. If a service requires pre-authorization, it means that your provider has to obtain permission from your health insurance company for you to receive the recommended service, such as a CT scan or referral. Even if pre authorization is granted, it does not guarantee that the insurance company will pay. There is no good evidence that pre authorizations decrease receipt of unnecessary care or that they improve care. What they do is lower costs by delaying or denying care. Finally, we'll define allowed amount. This is the negotiated amount that providers have agreed to be paid for a covered healthcare service. It may also be called eligible expense, payment allowance, or negotiated rate. And then there's the write off adjustment, which is also called the contractual adjustment. It's the difference between the amount a provider charges for a given service and the allowable amount for that service. If a provider participates with an insurance company or a government plan, such as Medicare or Medicaid, to accept patients under that payer's plan, the provider can't collect more from the payer or the patient combined than the allowed amount. Let's begin by reviewing some of the terms we'll be using in this discussion. First of all, there are specific documents that are associated with insurance coverage. Understanding how to read them can help make sure that you're only paying for the care that you receive and that what you're being asked to pay is correct. The Summary of Benefits and Coverage, or SBC, gives you a quick look at your insurance benefits, the deductibles, maximum out of pocket spending, or MOOPs, the costs associated with different types of services, and a list of some of the services not covered by your plan. An explanation of benefits, or EOB, is a statement that tells you and your provider how the charges generated from medical care you've received will be paid. All of the owed amounts flow from the allowable, which is the most that a provider will be paid for any given service. That amount is theoretically negotiated between the payer and the provider. Large provider groups and hospital organizations have greater ability to negotiate terms than small group or solo practices. Of the allowable amount, the EOB breaks down what you owe. In some cases, you'll owe the entire allowable amount, especially if you've not yet met your deductible. In other situations, you may only be required to pay a copay or a coinsurance amount. If you have met your deductible or have extremely generous plan benefits, you may not owe anything at all. The EOB will also document how much of what you owe is applied to your deductible and your out of pocket maximum. Evidence of insurance. Chances are you've never seen or heard of this, but you'll want to at least be aware that it exists. The evidence of insurance, or EOC, is the big contract. It spells out in detail what is covered and how, along with the rules of engagement. It is written by the insurance provider, such as Anthem or Aetna, and would be a part of any commercial coverage, whether that coverage is obtained from an employer, the marketplace, or as a Medicare Advantage plan. It serves as a legal contract between the insurer and the insured individual. To get started in the process of comparing and understanding your medical documents, you'll want to gather them together. Your medical bills, your EOB, remember that's the explanation of benefits, and your SBC, or Summary of Benefits and Coverage. This is just an example, but all EOBs should contain the same information. An EOB is generated for every claim. It will either be mailed to you or available through your insurance company's online portal. While it may say not a bill, it is extremely important, and you should review it and compare it to every medical bill you receive. It bears repeating. The EOB shows how your insurance company is handling your claim, what services you received, how much the provider charged, what cost your plan allows, how much, if any, the insurance company is paying your provider, and whether and how much you owe for the services you received. The EOB will also show how much of what you owe counts towards your deductible and out of pocket maximum. So let's go over some of the things you'll find on your EOB. Serve date is the date you received the services. Maybe you had a checkup, or maybe you visited the doctor for a cough and fever. The serve date is the date when that happened. POS, or place of service, indicates where you had the services done. For example, your doctor's office or a hospital. PROC, or procedure code, is a code or description of the service you received. Listed here are the CPT codes that indicate what services were performed. Note that these may be numeric codes, descriptions, or both. The GRC/RC amount is how much is written off for the services you received. The last column here, Prov PD, is how much the insurance company paid to your provider for the service listed. The first thing that you want to do is to verify that your name and the insurance plan are correct, especially at the beginning of the year. For example, if you have switched from United to Cigna, make sure that the claim was submitted to the company through which you were insured at the time the service was rendered. Make sure that the provider listed for that claim is the one that you saw on the associated date of service. Make sure that you are being charged for the correct service on the correct date. Next, let's talk about the Summary of Benefits and Coverage, or SBC. You'll recall from our earlier discussion that this document gives you a quick look at your insurance benefits, what types of services your plan offers, the rules that determine what you'll pay for the care you receive, and other important details. You'll want to pay careful attention to the deductible, copay, and coinsurance costs, as well as what types of services are covered by the plan. By law, your insurance company has to give you this information. Note that even if you're responsible for part or all of your premium costs, the SBC doesn't show these numbers. Also, this is just page 1. SBCs are usually several pages long. Also, the SBC is merely a snapshot of your benefits. More details are contained in the EOC. Based on the allowable amount with the information found on your SBC, you can determine what your bill costs should be for a given service. Make sure it matches what your EOB and plan say. You should compare what you experienced during your medical visit with the bill and EOB in order to make sure you were charged correctly and weren't charged for a service or procedure you didn't receive. If you're not sure, ask questions. We're going to go through an example now. Let's practice. This is our fake patient, Robert Garcia. In this example, he had an appointment with his primary care provider for a cough. Let's look at Robert's recent bill from his doctor's office. Here we can see a list of charges as well as payments made to the account by the insurance company. According to the bill, on December 7th, Robert was seen for an office visit and for a chest x ray. In this case, Robert did receive each of these services. The bill shows that on January 3rd, Robert's insurance paid $101.51 towards the bill. Also on January 3rd, there was a write-off adjustment of $193.11. We'll discuss that more when we look at Robert's EOB in a second. According to the bill, with charges, adjustments, and payments provided by his insurance, Robert owes $25.38 to his doctor. Now let's review Robert's EOB to make sure that everything lines up. This is Robert Garcia's EOB. Keep in mind that while EOBs from different payers might not look alike, they'll have most of the basic information listed here. To review briefly, this first column represents the date of service. The POS is the place of service and represents where Robert received services. This 11 indicates the services were performed at the doctor's office. Next, we see the PROC column, or procedure column. Listed here are the CPT codes that indicate what services were performed. Services may be listed as numeric codes, descriptions, or both. The billed amount is the amount charged by the provider for each service. Be aware that the amount billed from the provider is almost always higher than what the insurance companies allow for those services. The allowed column represents how much the insurance company has agreed to pay for a particular service. The difference between the billed amount and the allowed amount can be seen in the GRC/RC amount column. Sometimes this is called the discounted amount. This difference is written off by the provider, and neither the insurance company nor the patient is responsible for this portion. In this example, in the column, we can also see reason codes that explain why the claim is being paid the way it is. There's usually a glossary on the EOB that explains the codes. Deductible, copay, not shown, and coinsurance columns are the responsibility of the patient. Most insurance plans require some form of a deductible or a set dollar amount that the individual and family are responsible for each year, on top of any monthly premiums paid to the insurance company. Coinsurance is a percentage of the allowed amount. This can be a confusing aspect of your benefits because the insurance company may have different coinsurance percentages for different types of services. Copays, you'll recall, are fixed dollar amounts and can apply both before and after meeting your deductible. You'll want to refer to your SBC to find out your copay, coinsurance, and deductible responsibilities. This final column represents the amount the insurance company paid to the provider. These numbers represent the allowed amount minus any deductibles, copays, and coinsurance for which the patient is responsible. Now let's check to make sure everything is correct for Robert. As we saw on his bill, the services Robert received, an exam and a chest x ray, are seen on both the bill and the EOB, so that's good. We can see that the total for the allowed amount is $126.89. No costs are posted to the deductible because this visit was in December and Robert has already met his deductible for the year. His coinsurance totals $25.38. This is subtracted from the total allowed amount for a total of $101.51 paid to Robert's provider by the insurance company. Looking back at Robert's bill, we see the billed charges total $320. From that, the doctor's office wrote off $193.11. This matches with the totals in the RC amount or discount column on his EOB. Additionally, we can see a payment of $101.51 from insurance, leaving Robert with a balance of $25.38. This matches up with the coinsurance column on the EOB. So all of this looks correct. There's just one more thing to check. We mentioned that coinsurance percentages may vary by service type, so we'll need to check the numbers on the EOB with what Robert's SBC says. According to his SBC, Robert is responsible for the least of $25 or 10% of the allowed amount for a basic office visit with his primary care provided after he has met his deductible. In this case, 10% of the allowed $89.39 would be $8.94, which is less than $25. For his chest x ray, his coinsurance is 20% of the allowed amount, which works out to $7.50. When we compare the EOB to the SBC, we can see that Robert was charged 20% or $17.88 in coinsurance for his office visit when it should have been 10% or $8.94. This means that Robert's insurance should have paid $8.94 more to his provider, and Robert owes $8.94 less. In this case, the difference in real dollars is relatively small. That said, if it was a 10% error in coinsurance for a surgery charge or another type of expensive care, the difference between what the patient truly owed and what the EOB said the patient owed could have been a lot more. So, Robert will need to call his insurance company to have this corrected. Without looking at his bill, EOB, and SBC, Robert never would have caught the mistake and would have overpaid for his medical care. Let's look at another example. This is fictional patient Tamika Smith. Tamika went to her doctor for a cough and flu like symptoms. In looking at her bill and EOB, we can see that Tamika was billed for an office visit, a COVID 19 test, and a chest x ray, and that the EOB shows that she owes $7.50 for her chest x ray. But wait a second. Unlike Robert, Tamika never had an x ray at her visit, so she knows this is incorrect. Just to be sure, let's check the rest of her documents for any other mistakes. We can see that the patient and insurance responsibility amounts are the same on the bill and the EOB. The amounts applied to coinsurance have been calculated correctly according to the SBC. The write-off amount and provider-paid amounts are consistent with the billed and allowed amounts, as well as the coinsurance charges. The coinsurance percentages also match with the information in her SBC. The problem is that Tamika was charged for and her insurance paid and assigned her costs for a chest x-ray that she didn't have. So, given this discovery, Tamika would need to call her doctor's office and insurance company to correct the charge for the x-ray that she didn't receive. These are just two examples demonstrating the need to make sure all your medical billing and coverage documentation line up and are correct. Before we finish, here are some more tips. As you're comparing your bill, EOB, and SBC, if you find mistakes or have questions, call your insurance company. They should address any problems you might find. And if there's a billing error, you should also contact your provider. Remember to keep your papers organized and document any conversations with your insurance company or provider's office. This documentation should include the date of the call, who you talked to, the purpose of the call, what explanation you were given, if any, the plan, and when to expect next steps. Thank you for attending our session on understanding medical bills. Last step, please take our survey. It helps to show our funder that people are using this material and increases the chance that we will be able to continue to provide useful information on healthcare coverage in the future. If you are interested in staying up to date with the Asclepius Initiative, there's a lot of great information that we share on our monthly newsletter. Feel free to scan this QR code to sign up for that. We don't do anything with your information other than send you a great newsletter every month. You can follow us on the following social media sites. We're on LinkedIn, Facebook, Instagram, Blue Sky, and YouTube. If you need more information, we have you covered. You can go to asclepiusinitiative.org/toolkit or scan this QR code. We have a lot of amazing free resources on our website, and I encourage you to check that out. I want to thank the Kentucky Department for Public Health and their grant that lets us bring this information to you at no charge so that people like you and me can get the resources we need to better understand our healthcare coverage.